Hi, I'm Sable Schultz, she, her pronouns, manager of the transgender services at the Center on Colfax. Um, Today we are here with Ron DeVries talking about PrEP. Ron, he, him pronouns, is the Health Enrollment Program Consultant with the Center for African American Health and former Health Education Program Manager at the Center on Colfax. Ron has a master's degree from CU Denver and has spent over 25 years in the field of medical practice management and healthcare administration. As a 4-year certified health coverage guide for Connect for Health Colorado, he has helped many members of the community obtain health coverage, including enrollment in programs specifically for HIV prevention, which is our topic today. Welcome, Ron.
Thank you, Sable. I appreciate your inviting me here and having me talk to our community about a very important medical development that really is making a great difference in our community and our lives. Just to give a little context to our conversation today, I have to go through some disclaimers so that everyone understands kind of the limitations that we have in doing these kinds of presentations. First of all, the information presented here today represents the opinion of myself and does not represent the position or opinions of the Center on Colfax, the Center for African American Health, Connect for Health Colorado, or any other affiliations that I have. The information I share here is not intended to be a replacement for or any type of medical advice. Anyone who needs more than this basic information about the topic can seek the help of a medical professional. And I am speaking on a topic of sexual health. It is intended to be a sex-positive conversation without judgments or presumptions about the audience or their behavior.
Oh, that's great. Thank you, Ron.
Thanks.
So, what are some keys to HIV prevention?
So those keys there's 5 of them. First of all, knowing your status and getting regular testing done. It's very important that you at least get some type of rapid testing through a finger stick. You just stick your finger and take a drop of blood and test that drop of blood, and within about 5 to 15 minutes, depending upon the test, you'll know with a high level of certainty if you are positive or negative. Accuracy rates are generally above about 90% for most of those rapid tests. If a test comes back positive in that situation, they will always do a full blood draw with laboratory testing, and that takes a few days. But that's also something that you can just request right at the outset with your doctor, is to just get a full blood draw and laboratory testing, because the accuracy there is virtually 100%. The second key to HIV prevention is really one of the things that we're going to talk most about in this conversation, which is PrEP. Pre-exposure prophylaxis is a once-a-day medication to prevent the transmission of HIV. I'm going to talk a little bit later about how it works and the various types of pre-exposure prophylaxis that's available. And I'm going to talk about the protocol that someone has to do in order to stay safe with the use of this medication. There is a third key to HIV prevention, which is post-exposure prophylaxis, or PEP. PEP is typically used more as in terms of an occupational exposure to prevent transmission of HIV. And when I use that word transmission, there's actually a more technical word that's more appropriate. I'm still going to use transmission, but the word that I'm talking about is called seroconversion, which is where the virus enters your body and is able to replicate itself and keep producing more and more of the virus. That conversion is really what's happening when someone acquires HIV. But we often refer to transmission as another term that we use in this conversation. But it's not 100% accurate when it comes to the pre-exposure prophylaxis. So PEP, as I was saying, is a short-term regimen of medications. It's a full panel of medications that are used to treat HIV, where PrEP is only a couple of components of that medication cocktail. Fourth, we're going to talk about a little bit about condoms and their continued necessity in this conversation, and then also treatment as prevention. So that's those are the 5 keys to HIV prevention that we're going to talk about.
Great. Can you tell us a little bit more about PrEP?
Sure. So there are 2 brand name medications available for the PrEP regimen to reduce seroconversion. PrEP consists of 2 medications in that one pill, either of which taken daily can prevent HIV transmission through sex by about 99%. They can't say 100% because if someone did, obviously, they would get sued. So the company can't say that our medication is 100% effective because there's always that very, 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 very small possibility of that medication not doing its job. Truvada was the first medication approved for this indication and consists of 2 medications, emtricitabine, or FTC, and tenofovir disoproxil fumarate, which is TDF. These 2 drugs in combination become an HIV reverse transcriptase inhibitor. I know that's an awful lot of medical jargon. But we talked about how seroconversion is where the body starts producing virus within itself and then infects the entire body. And the reverse transcriptase enzyme is a key factor to allowing the body to do that. So when we take a medication that inhibits that enzyme's effectiveness, we are able to keep the virus from replicating in the body. HIV reverse transcriptase, like I said, is that enzyme that allows the retrovirus cell to use the body's cells to replicate. These 2 medications, along with integrase inhibitors, are integral to the treatment of HIV. So these are 2 medications that are part of a 3 medication cocktail that's used for treatment. Descovy is another medication that's been approved for prevention of HIV transmission. There's a small caveat with Descovy that we're going to talk about in a little minute. Like its predecessor, Truvada, Descovy combines 2 medications, the emtricitabine and the tenofovir alafenamide, which is a slightly different formulation of tenofovir, to inhibit the enzyme that allows the retrovirus to reproduce in the body's cells. The benefit of this medication is a lower dosage of tenofovir is required for the medication to be effective. It's only 10% of that tenofovir component compared to Truvada. So that medication reduction is a significant advance that Descovy has over Truvada. So that's how these medications work.
That's awesome. So how does somebody get on PrEP?
Well, PrEP is actually intended for those at high risk for HIV transmission. And these are kind of broad categories, but generally, these categories include men who have sex with men, or MSM, women who had unprotected sex with 1 or more partners, or have had a sexually transmitted infection in the past 6 months, people who inject drugs, transgender individuals. So those are the 4 broad categories of folks that are considered at highest HIV transmission risk. There is a website available at the CDC where you can actually answer a few questions about your personal risk and get a determination from the CDC's website there about your risk factors with regard to HIV. But my general rule is that just about everyone probably fits into one of those 4 categories. So why not just make medication available for everyone? That's my premise. So PrEP for everyone. That's my slogan.
That sounds like a great idea. How affordable is PrEP?
Well, before we get into the affordability of PrEP, let me talk about that second type of PrEP. Truvada is available for anyone who weighs at least 77 pounds. So that means that it's available for even teenagers who might be in this risk, in a high risk category. Descovy, on the other hand, is only available to men and transgender women weighing at least 77 pounds. And why is that? Well, clinical trials for medications have stringent guidelines when being tested for new indications. This medication was approved first for treatment of HIV in men and women, but when it was tested for prevention, cisgender women and transgender men were not included in the clinical trial. And it's my personal opinion, just my opinion, that this was done to speed up the enrollment of test subjects in their clinical trial and get it approved before a generic version of Truvada, its predecessor, became available. Generic Truvada is on the way. There are at least 5 companies that have had generic versions approved by the FDA, but due to drug patents and/or drug exclusivity, they're not yet available in the United States. But that may change in the next couple of months as the Truvada patent is about to expire.
So how do people get on PrEP?
So PrEP is only available by prescription from a physician. And here's why. Testing to ensure your HIV negative status is essential before you're placed on this medication. They have to make sure that you're negative, which means you have to do the blood draw type HIV test. They also need to test you for a number of other STIs, a couple of types of hepatitis, and if a woman seeking PrEP, then they need to do a pregnancy test as well. They also want to get a baseline on your kidney function because there is one part of the medication that has side effects that affect your kidney function. And in order to keep that from happening, they want to be able to test where your kidney function is before you start the medication, and then closely watch it as you start taking the medication on a routine basis. So they'll do this initial testing at the start of the treatment, and then they'll ask you back in 30 days to receive another renal function test or the kidney function test to make sure that your kidneys aren't being affected in a negative way. And then after that, they will test every 3 months. And that is going to be ongoing for the remainder of your use of the medication. It's absolutely essential that they keep doing this testing to make sure that you don't, for some reason, become HIV positive. So they'll keep doing an HIV test. They'll lower the frequency of the HIV test to twice a year after the first few iterations. as well as some of the other STIs. But generally, they want to check that renal function every 3 months. That's very essential. There is one small caveat here as well. The Colorado legislature passed a measure this year that will allow the Colorado Board of Pharmacy and the Department of Public Health and Environment to collaborate on development of a protocol by which pharmacists can prescribe PrEP. The deadline for creating that protocol is January 1st of next year, but it's uncertain right at the moment if the pandemic is going to cause a delay in the publication of that protocol. But soon, we will be able to get a prescription for this medication directly from a pharmacist without a doctor's needing to prescribe it. Here's my personal concern with that is who then is doing all of the blood testing, and how is that being tracked and traced if you're getting your medications directly from a pharmacist without a physician's kind of interaction? That's the question I have that I'm sure the protocol is going to address. So I'm looking forward to reading some of the details around that.
Yeah, that'll be really interesting. And it's really good to point out that there are people of all genders who are able to get pregnant. So back to the question about getting on PrEP, how affordable is it for community folks?
Well, fortunately, Colorado is a wealth of riches with regard to options for making PrEP more affordable. Part of that is, our own healthcare marketplace, Connect for Health Colorado, for which I am a certified health coverage guide. I can assist somebody who needs to get health insurance through the exchange and obtain a policy that will cover a lot of the costs, because it's not just, of course, the medication, but it's also the doctor's visits and the testing. All of those costs are included in this protocol and need to be addressed. Health insurance is the start, but the state of Colorado, through the Department of Public Health and Environment, has a program under the AIDS Drug Assistance Program to help with all of those out-of-pocket costs that you might still incur, like the doctor's office copay or the co-insurance that you need to pay for the lab testing that gets done. So if you have your own insurance through an employer, you might still be eligible for this state program because it is based on income, just like the Affordable Care Act plans are, but its threshold is a little bit higher. So there's more people that can actually get into the ADAP program than just the Affordable Care Act plans. Colorado Peak is the website used to apply for Colorado's Medicaid. So if someone qualifies for Medicaid, Medicaid will cover the costs of PrEP. And for those who don't qualify for any of those programs, Gilead, the company that makes Truvada and Descovy, also has programs to help cover at least the cost of the medications. So there's lots of different routes by which we can make PrEP much more affordable, if not free, for anybody who qualifies for it.
Well, that's great. So tell me about condom use then. Is this an excuse for people to stop utilizing condoms?
Well, no. As you mentioned, pregnancy is still a concern, and condoms obviously are very effective at preventing pregnancy. There are also other STIs out there that are pretty nasty, and there are even some that are drug resistant. So it's HIV prevention, of course, is an important thing, but it's not the only danger out there. So really, PrEP is meant to be a very strong component to a whole list of ways that you are helping to keep yourself healthy and still sex positive.
Right. And tell me about this idea of treatment as prevention.
Sure. Treatment as prevention, or TAP, is also kind of expressed in another short acronym, U equals U. They have found one of the many advances of the study of HIV is the recognition that effective treatment of HIV can prevent transmission to others through sex. HIV positive individuals who are able to attain an undetectable viral load, defined differently by different testing methods, but generally accepted as less than 200 copies per milliliter of blood, are drastically less able to transmit HIV through sex. So when we talked about, that replication of HIV in your body, the inhibition of that using the same medications that are used for PrEP is what I'm talking about by keeping your viral load very, very low or undetectable. So U equals U is the short form of this concept. Of course, nothing is 100% effective, but when the chance of infection is less than 1 in 130,000, that is expressed as 0.0000007%. That's just about as close to 0% chance as you can get. Now, why this number of 130,000? Well, in 3 studies between 2016 and 2018 of partners of mixed status, they showed no transmission of HIV from the positive partner to the negative partner in 130,000 acts of condomless anal sex where the receptive partner was negative, which is the most risky act and position combination for the transmission of HIV. So they did these studies, these longitudinal studies with multiple partners, couples, I should say, where the receptive partner was negative and the top was positive, but immunosuppressed or with an undetectable viral load. And that combination, that bipolar combination, did not result in any positive cases over the course of these 3 different studies.
That's really amazing. So what's the next step then?
Well, you really need an appointment with me so that we can talk more about this and we can talk about your specific situation for helping you get set up with some of these affordability measures that we talked about, the insurance, the ADAP program, and the Gilead copay coverage program for medications. I have links for a lot of other resources related to HIV treatment and prevention on my website. And you can just call or text me at 720-699-4897.
Great. We'll have this information down in the description. Thank you very much, Ron. Was there anything else that you wanted to share with our audience today?
Well, like I said, on my website, there's a lot of resources out there, but there was one resource that I relied upon heavily to create this presentation, and that is a website called prepfacts.org, prepfacts.org. So I'd highly recommend, if you want to learn more about this subject, that you consult that website. They've got great information and a whole plethora more links to other resources. And I wanted to say thank you for those who are watching and for the Center on Colfax for having me do this presentation. It's been a pleasure.
Definitely. Thank you as well, Ron. You have a wonderful day.
You too. Thanks, Sable.